guys, Lindsay here with Beyond Physical Therapy. I'm going to show you one of my favorite hip stretches. It's a little bit different than most of them that you've seen because this one actually works at your hip joint where the ball meets the socket. This is great for people who feel like pinching going on like deep in their groin and you can't just like get to the right spot to stretch it, or anyone who's been diagnosed with hip arthritis or any hip labral issues or hip impingement issues. This is a stretch that pulls the ball just a little bit away from the socket. And then what happens is that the capsule, which is the ligaments that hold the ball in the socket, get a little bit of a stretch as well. And then by bringing that ball a little bit away, we're creating a vacuum. So then when you get that distraction, more fluid moves into the joint and it actually exchanges with some of the old gunky stuff that was in there before. So it's like new lubrication and like some WD-40 for inside your joint. And that can help with some of that like pinching that you're feeling that you can't just seem to stretch out. So give this a try. So what you're gonna do is use a band. I like the Amazon Basics purple band. This is gonna depend on how big your leg is, but I find for the most part that purple works really good here. And then what you do is put the leg that you want to stretch. So in this case, we're going to stretch my left leg. So I'm going to put my foot in the band. And now you can either like just put it in there once, but I like to loop it around one more time just so that your foot's not going to fall out of it. So I've got that like super loop going on. You can get your toes outside of the band there. And then if you want some more support, put a foam roll underneath that side and then lay back and back up. So the foam roll's not doing anything besides just supporting my leg. And then as I back away, now the band is pulling my leg down and away from me. And seriously, you guys, it feels so good. Or if you ever feel like your low back is really stiff and you just want like someone to like just pull on you and open it up, this feels so, so good. Another thing you can do too is create even more of that pumping action. So you can bend one knee and then you've got that like arch in your low back. So you can flatten that out by tightening your abdominals, and that pulls me farther away from the band. And then I can relax and then the band pulls me more that way. So tighten the abs, increase the tension on the band, and then relax it. And you just go back and forth. Now I'm trying to keep my butt cheek and keep my leg here as relaxed as possible. All of this movement is just coming from tightening my abdominals and then releasing them. So you can hang out in this position for like up to 10 minutes if you'd like, but I would recommend giving this a solid like 30 to 90 seconds at a pop just to see how it feels and get a good idea of if it's gonna help you or not. Because the joint capsule is really like fibrous and stiff, it needs a little bit more time to stretch than just a typical muscle for 30 seconds would. So 30 to 90 seems to work better here. So just do that little tilt or just hang out and just let that thing pull on your leg. You also can go on your side to change the angle of the pull, back away a little bit, and just let that band just pull on your leg there and enjoy that like kind of deep stretch that you feel. Again, hang out there for about 30 to 90 seconds and see how it feels. Thanks, guys.